Adjusting your lifestyle for diabetes is a lifelong process for type 1 diabetics. But type 2 diabetics may actually find they can reduce or eliminate their need for medication with the right guidance and lifestyle changes. Dr. Tanya Khoury is the Clinical Director of Functional Medicine with the Joseph Health Group. She's here now with insights on how you can treat and possibly beat type 2 diabetes. Welcome to Living Well.
Thank you for having me.
So let's start at the top. I know a lot of folks who are dealing with type 2 diabetes. In my family, they called it sugar diabetes. And the prognosis was always, well, you're going to have to watch your sugar intake and exercise.
Yep.
But for so many people, they rely on the medicine just for the rest of their lives.
Absolutely.
How are things different with you guys?
Well, in our office, we treat people as an individual. So most people do think diabetes, if I lose weight, if I watch my sugars or my diet, I can manage this. But there's ways to reverse it. And in our office, we look at people as an individual. So we find out what's the root cause, and then we can treat that.
And what are some of those root causes?
So a lot of times there's, when I look at a diabetic, I look at them as someone with a blood sugar problem, not as a type 2 diabetic. And there is a mirage of things that can cause this. It could be your gut health, it could be adrenal fatigue or cortisol issues. It could be something as simple as your thyroid. People don't realize thyroid and diabetes go hand in hand.
So what do you recommend people do?
So a lot of times the way we treat in our office that's different, when people come to us, we look at them as an individual. Most diabetics get frustrated because they're treated as a diabetic and generally very much the same as a label. When someone comes to our office, we look at them as an individual and we go through specific testing to find out what's really going on in your system, and let's treat that. Let's treat the root cause and not just the symptoms.
So if someone follows the protocols and changes their lifestyle, can they actually reverse the diagnosis?
Absolutely, and it's amazing. We see it every day, I know. I get excited. But what we see in our office, when people follow what we say, we see amazing results. People getting off their drugs, getting off their insulin, people losing weight without exercising. It's changing people's lives.
It's really important to note that there are so many other factors that go in. We don't hear that very much in today's common talk around the water cooler or whatever.
Yeah, most of us are treated kind of in the same box, and we're treated like this until things start to go down. But there are so many other ways and so many other options.
So you guys are providing a free seminar so people can come out and get more information. Tell me about that.
Absolutely. So we will be talking on March 4th at the Lariat Club, and I will be giving a lunch presentation, and I will be talking about what are the different options. We shouldn't all be treated the same exact way. How can we handle diabetes as an individual? What are the steps you should go through? And then I give more information on that there.
That is fabulous. We've got a slate of information and a phone number so people can get more information on how they can come out and take part in this seminar, because I think it is so important. So many people dealing with diabetes these days, and how they can be treated as an individual with you guys as well. So thank you so much for all that you're going to do. Any advice for people in the meantime before they get there?
The advice I give everybody is be an advocate for your health. There are so many options out there, and make sure you look for those, and make sure you know there are other options, and be treated as an individual, not as a label.
Dr. Khoury, thank you so much for being with us and for all the great information you've provided to us here on Living Well today.